Good afternoon, guys. Here's your B for you. Now we're discussing fee-based primary care, part 2. Okay, fee-based primary care models. Concierge medicine and direct primary care, or DPC, are expanding rapidly across the United States, reshaping how Americans access primary care and intensifying concerns about shortages for the public. A recent multi-institution study highlights shrinking growth between 2018 and 2023. The number of such practices rose by 83.1%, while the number of clinicians working in them increased by 78.4%. The surge reflects a fundamental relocation of physician time toward patients who can afford membership fees, leaving fewer clinicians available to those relying on traditional insurance or public programs. What fee-based primary care is? Concierge medicine. Patients pay an annual retainer, sometimes thousands to tens of thousands of dollars, for enhanced access, longer visits, and personalized services. These practices often still bill insurance for office visits and procedures. Direct primary care, or DPC, patients pay a smaller monthly or annual fee, but these practices operate outside the insurance system entirely. The model emphasizes simplicity and direct access, often with unlimited visits and communication. Both models promise more time per patient continually and responsiveness, but they achieve this by shrinking patient panels, meaning each clinician serves fewer individuals overall. Why this matters for the public. Reduced capacity for non-members. When clinicians move into fee-based practices, they often cut their patient load dramatically, sometimes from thousands to a few hundred. This improves care for members but reduces availability for everyone else. Financial initiatives or incentives. Membership fees provide predictable revenue streams, making these models attractive to clinicians facing burnout or financial strain. in traditional insurance-based practices. Equity concerns. These practices tend to cluster in wealthier urban areas and suburban areas, leaving rural and lower income communities with fewer primary care options. The result is a widening gap in access to timely preventative care. Systematic ripple effects. As more clinicians shift to fee-based models, safety net clinics and insurance-based practices may struggle to recruit and retain staff, worsening wait times and limiting care for Medicaid and Medicare patients. Policy and workforce implication. Health policy experts warn that this trend could accelerate existing shortages in primary care, especially as the U.S. faces rising demand from aging populations and chronic disease management. Policymakers are exploring countermeasures such as prospective payment platforms or reforms, offering primary care practices predictable funding streams to reduce reliance on fees for service billing. Value-based care incentives, rewarding practices for outcomes and preventative care rather than volume. Safety net support, increasing funding and workforce incentives for clinics serving vulnerable populations. The effectiveness of these reforms will determine whether fee-based models remain a niche option or become a dominant force that reshapes access nationwide. The bigger picture. The rise of fee-based primary care reflects deeper systematic issues. Underfunding of traditional primary care, clinician burnouts, and patient frustration with rushed visits and fragmented care. For those who can afford the membership, these models offer relief and personalized attention for the majority. However, the risk creating a two-tiered system where access to timely, comprehensive primary care depends on ability to pay. The bottom line, fee-based primary care is growing fast, offering better service for some, but threatening to worsen shortages for the many. It represents both an innovation in care delivery and a challenge to equity, whether reforms can rebalance The system will shape the future of American primary care and determine if it remains a universal gateway to healthcare or becomes a premium service for privileged few. Okay, guys, that's your B for now. So with that being said, I'm going to take a break and I'll be back on with C shortly. For now, Gator Wellness. Take care, folks.